Not having sex lately, finding yourself being shot down by women, or your wife has been focusing on other things lately than your intimacy. If a lack of sex has been going on for too long in your life, it may become a health concern according to recent studies. No one wants to experience long dry spells without sex, and most people enjoy and desire intimacy from their partners. If a dry spell does occur, some adverse changes may happen in the body, affect your arousal in the future, and possibly negatively impact your immune system. Here are the worst side effects from lack of sex according to recent scientific studies. Lack of sex and the negative impacts on health. Increased stress. It is well known that sex can greatly reduce stress in one's life. Regular intercourse seems to be even more effective at reducing stress than masturbation, according to a 2005 study found in Biological Psychology. The effects of sex are hormonal, causing an increase in endorphins and oxytocin. Both of these play a role in our moods, and oxytocin can even lower the effects of the stress-inducing hormone, cortisol. Diminished brain growth. According to researchers at Oxford and Coventry, having more sex can increase your IQ. Regular sex was found to be correlated with higher scores on tests for fluent speech and visual perception. In a study involving rats, the rats produced new brain cells after mating. Lowered immune system. Not enough sex impacts your immune system, meaning you will get sick more often. No one needs that. The immune system is actually given a boost from regular sex due to an increased production of immunoglobulin A, an important antibody. Wilkes University studied this phenomenon and found that subjects who had sex at least twice a week produced 30% more immunoglobulin A than those who did not engage in any sexual activity. Increased risk of heart disease. Heart disease is one of our main killers in this country. Having more sex may reduce your chances of developing it. For example, having sex twice a week was found to reduce the chances by 50% of a man getting clogged arteries when compared to those who only had sex less than once a month. The Journal of Sexual Medicine published results showing that having sex was correlated with the lowered levels of homocysteine, an amino acid that is found to be a risk factor for heart disease. Better circulation and more robust blood vessels, both results of increased sex, help to control homocysteine levels. Erectile dysfunction. A study in 2008 found that men who had sex less than once a week were twice as likely to have issues getting or maintaining an erection than those who had regular sex sessions. Prostate cancer risk. A study conducted in the United States found that men who ejaculate 21 or more times a year had a 33% lower risk of succumbing to prostate cancer when they got older. Pornography has negative impacts. If you resort to pornography during a dry spell, this may be an issue as well. There has been recent debate on this topic with many researchers and doctors stating that frequent porn use can desensitize a man to real-life sexual stimulation and lead to erectile dysfunction. It has been found that boys and young men who become addicted to porn suffer from the same erectile dysfunction issues as middle-aged men typically do. Not good. Feeling a lack of desire for sex? Perhaps as you've gotten older, you find yourself experiencing a lack of desire for sex. Given the previous information, this could be a cause for concern. Many people, both men and women, experience this lack of desire as they age. Most of the time, the reason for this issue is due to hormonal imbalance. The feelings of desire, the physical signs of desire, and the psychological aspect of sex are all impacted by hormones. Hormonal deficiencies and imbalance are typically characterized by symptoms such as fatigue, hot flashes, weight gain, brain fog, mood swings, erectile dysfunction, and regular lack of desire for sex. If you are experiencing several of these symptoms, you might want to consider getting your hormones tested. It is easy to spot a hormone deficiency with a simple blood test. Consider exploring hormone replacement therapy, also known as HRT, options to feel better and get back into a regular and fulfilling sex life. Contact us today to get started. Click the link below in the description of this video.